Hello everyone. In this video, I'm going to talk about obsessive compulsive disorder, and I'm also going to talk a little bit about causes and treatments for some of the different anxiety disorders. I wanted to highlight this show called Obsessed from A&E. It was a really good show. I think there were 2 seasons of it. You can still see it on YouTube, and I am going to post a video about Chad from this show. It does a really excellent job of describing, and really what it does is it follows people that have obsessive compulsive disorder and really explains very well what obsessive compulsive disorder is, and what it's like to have obsessive compulsive disorder. So if it's something that interests you, I would highly, highly recommend this show. So let me ask you guys some questions about OCD. And one of the things that happens with medical students and also psychology students too is a lot of times we might see ourselves in some of these symptoms. And many people who are successful do have some OCD traits, which is obsessive compulsive traits. And that's part of what makes us actually successful. But there's a big difference between having an OCD trait and then also having the disorder. So you're going to really clearly see that, especially when you watch the videos. Do you have a favorite number? I have a favorite number. It's 8. Do you like odd numbers to even numbers? Do you compulsively check things? Do you always have to check things multiple times, that you locked the door, that you turned off the stove, those kinds of things? Are you compulsively neat? Does everything have to be in order? I used to have a picture of David Beckham, which I don't know if any of you guys care about, but every time he would go into a hotel room, he would have to organize everything in the room until it was the way he thought it should be. He would go into the refrigerator and turn all the soda cans to the right way. And he couldn't get comfortable unless he did that. So many of us, have had that thought. We're driving to school or to work. Did I check did I lock the door? Did I shut the garage? Did I turn this off? And sometimes we might go back and check because we really felt like we don't really remember. Um, and that's okay. That's normal to go back and check one time. Somebody that has OCD will actually go back and check multiple times, or they might be stuck at that door, unable to decide whether or not they really did lock that door. And that could be a day-long experience for them. So that's the difference. It's one thing to have that thought in your head and to feel compelled to go back and check on it. That happens to a lot of us, and especially when you're under a lot of stress, you're not necessarily paying attention to things. And a lot of the stuff like locking the door, we do automatically. We don't necessarily pay close attention to it. So when we have that thought, did I do it? We don't really have a recollection of actually doing it because we weren't really paying attention at the time. We just automatically did it. So it's normal to have that thought on occasion, and a lot of times you'll have that thought when you're under a lot of stress, and you'll feel compelled to go back and check it. And then you feel better once you go back and check it and you go on with your day. Somebody with OCD will go back and check it and might start to leave again and feel like I'm not sure if I did lock it, and go back and check it, and then they'll check it again and again and again, and they'll be at the door forever. So it's one thing to have that thought on occasion and have to go back and check, but it's another to not be able to convince yourself that you've actually locked that door, and that's really OCD. Being neat is kind of a good thing. It's important to be neat, but can you are, are you completely uncomfortable if things aren't exactly the way you think they should be? That's a problem. Fear of germs. We're all really concerned about germs right now with COVID, and we want to be really cautious about germs. But Howard Hughes, I think it was in the 1950s or so, he was like the richest man in the world, and he ended up dying at a very young age, living in a hotel room with nothing but a mattress. He was afraid to leave the room. He was so afraid of germs. I think he probably died of malnutrition because he didn't eat because he was so afraid of germs. Howie Mandel is somebody you guys might know. I think he's on America's Got Talent now. He was a comedian back in the 80s, and he really didn't have a career there for a while because he got so overcome with OCD symptoms. And he describes, standing at a door, not being sure if he actually locked it for hours at an end. He describes being washing his hands and not being sure if he got all the germs off and having to rewash them, and standing there at the sink for hours. People that when we talk about compulsive hand washing, of course, we're all supposed to be washing our hands right now and being really careful about it and cautious about that. That's not compulsive hand washing. When somebody has OCD, they will stand there and wash their hands, and they'll be done washing their hands and they'll have this thought, I don't know, I don't know if I got all the germs, and they'll go back and they'll wash it again and again and again, until their hands are bloody and raw. I saw a client when I was doing counseling that had, he would spend the entire day in a shower, and he had a whole ritual about how he took a shower, and if something went wrong during that ritual, he'd have to start all over. So in his ritual, you had to wash your hair, first and do other things. But if you accidentally touched the wall of the shower or the shower curtain, or something went wrong, or he dropped the soap, then he would have to start his whole routine over again. And he would spend hours, many hours of the day taking a shower. So that's where OCD comes in. That's where the disorder comes in. You may have an obsessive thought every once in a while where you feel compelled to go back and check on something, but that is not obsessive compulsive disorders. So people with obsessive compulsive disorder have a lot of rituals that they feel like they have to perform. When you watch the video about Chad from that show Obsessed, he has so many rituals that just consumes his day. So he's brushing his teeth. He has to flip the toothbrush around a certain number of times and tap it on the sink a certain number of times and look a certain direction. And if he doesn't do that right, he's got to start it all over again. And so his whole day is consumed with these OCD rituals. And that's really what separates, just having an OCD symptom from actually having the disorder. So symptoms of OCD, it's characterized by obsessive thoughts and compulsive behaviors. And what happens is that they become so time consuming that they're debilitating, that they interfere with a person functioning in life at all. So the obsessions are an obsessive thought. So it's a intrusive and unwanted thought. Did I touch something dirty? Did I turn off the stove? And then the compulsion is the behavior that you feel like you have to perform to avoid anxiety. So you might have to constantly check and check something, hand washing till your hands are bleeding and standing at the door for an hour, because you feel compelled. You feel like if you don't do this, you're going to have all this anxiety. Chad in the video talks about doom and how he thinks he's avoiding doom by performing all these rituals. So they think that they're avoiding the anxiety by doing all these rituals, and they're avoiding the doom, whatever the doom actually is. But really what they're doing is creating their own hell, their own, just lack of being able to function in life. So OCD can be super debilitating for many people, and it's something that can be treated, but it is really difficult to treat. It's one of the more difficult anxiety disorders to treat. We do know that there's a genetic link to OCD and many of the other anxiety disorders as well. If you have a relative with an anxiety disorder, you're at a much higher risk of having an anxiety disorder yourself. We know that the amygdala, which is the emotional center of the brain, is involved in the fear response and triggering that sympathetic nervous system. And we know that the amygdala in people that suffer from severe anxiety has much thicker neural connections, and definitely is much more reactive. And much more, likely to activate that sympathetic nervous system. OCD sufferers and many anxiety sufferers as well have lower serotonin activity in the brain. So that's one of the reasons why antidepressant medications can be really helpful with OCD and with some of the anxiety disorders as well. There's something called the OCD circuit, which is the orbital frontal cortex. It is part of the frontal lobe of the brain that seems to be involved in OCD as well. We also know that the environment is really important as far as learning anxiety. We know that if you grow up with an anxious parent, you kind of learn to be anxious yourself. We associate the place where a panic attack occurred with that panic attack and with anxiety. We associate associate an OCD ritual with relief from anxiety, and people get negatively reinforced because they think that they're avoiding anxiety by doing these rituals. And they also feel like they're going to get punished if they don't perform their rituals. The doom is going to happen. So, people with social anxiety disorder, they have a bad experience in a social situation. They don't ever want that to happen again. So they put that together and they avoid those social situations in order to prevent that from happening again. There's also irrational and distorted thinking involved in anxiety. Can our thinking actually decrease our anxiety or actually increase our anxiety? And we know that both are very true. We can calm ourselves down, talk ourselves down from an anxiety attack, or we can make that anxiety attack worse by how we think about it. When somebody has like a panic attack or an anxiety attack, if they start to think I'm going crazy, I'm, having a medical emergency here, that increases the level of anxiety and increases that anxiety response as well. So we can control our thinking and we can control the anxiety to a certain degree. And counseling can be really helpful in dealing with those distorted and irrational thoughts. This isn't just about thinking everything's wonderful or trying to be positive in our thinking, but it's trying to be rational in our thinking and realistic in our thinking. A lot of times we're really harsh in our thinking and hard on ourselves in our thinking, and that we don't have to be. And doing that, sometimes I think people think that by being hard on ourselves that we're making ourselves better, but truly what we're doing is deflating ourselves and making things more difficult for ourselves. And counseling can be really beneficial in teaching people that. So cognitive behavioral counseling, systematic desensitization, and that exposure therapy we talked about for phobias is a form of cognitive behavioral therapy. And meditation can actually be really helpful in reducing overall stress for people, giving your brain a vacation from all that anxiety and stress. So meditation can be really important just to reduce that overall stress level and help hopefully reduce anxiety attacks and also reduce panic attacks too. Medications are somewhat problematic for anxiety. The anti-anxiety medications that are the most popular, Xanax is probably the most commonly prescribed anti-anxiety medication. Valium was the first anti-anxiety medication developed in the 1960s. And it was kind of widely prescribed to people, and they thought it was a miracle drug at the time, but they didn't recognize that it was highly, highly addictive. People developed a tolerance and a strong addiction to Valium, and Xanax is the same way. That's the same family of drugs. So it's really only for short-term use, and it really only gives you a brief relief from your anxiety symptoms. It only lasts about 4 hours or so, and once that medication wears off, the anxiety returns. So really only all it does is take the edge off the anxiety, but it doesn't take away the anxiety. It doesn't solve the cause of that anxiety at all. And when we talk about tolerance and addiction, tolerance means that you start to need more and more of the medication to get the same relief that you got from the initial dose that you had. And what happens is you can get to a dose that's really dangerous as well. So it's really important to be really cautious about anti-anxiety medications and really kind of treat them like an opiate where you take them for a couple of weeks if you desperately need them, and then no more after that. There are some anti-anxiety medications that are not benzodiazepines that are supposed to be non-addictive. Klonopin and Buspar are two that I'm aware of. That can be useful. Antidepressant medications have actually been shown to be really highly effective in treating anxiety. The lower serotonin levels have been definitely found in people with anxiety, and so if we can increase that level of serotonin in a person's system, it helps with anxiety and also helps with depression as well. One of the older antidepressant medications, amitriptyline, is sometimes used for OCD and some of the anxiety disorders because it has a really calming effect for people as well. So that is it on anxiety disorders. I'm going to cover post-traumatic stress disorder in the next video.